Thanks, Ellen. I'd now like to introduce Craig Monsen, the founder of Symcat. Take it away.
Hi there. I'm excited to be here. My name's Craig Monsen, and I'll be introducing you to Symcat, which is your guide from symptoms to solutions. So just very briefly, David and I created Symcat, and we're medical students at Johns Hopkins and web developers. We built it on, much of it, on public data sets, which I'm happy to tell you more about. But first, the problem. Let's say you get sick. You have bad back pain. Or your daughter's sick. She has a sore throat. You have a number of questions floating in your head. So, do you take some medicine? Do you call a doctor? No. You ask Dr. Google. The trouble is, he's not a very good doctor. He thinks your back pain is either tuberculosis, malaria, or metastatic breast cancer. In fact, a recent study determined that you're about 1,000 times more likely to encounter brain tumor in web search results than you are ever to have it. There's a word for this. It's called cyberchondria. Now, imagine if you could find out what patients with your symptoms actually had. Symcat is a web and mobile app designed to help you figure out what you may have and what you should do about it using data-driven algorithms. Allow me to demonstrate. So here's the Symcat website. And for the purposes of the demonstration, I'm going to say I'm a woman and I've been having back pain. So I'll start out by entering back pain, if I can spell it right. And just like with Google, I get real-time suggestions. So here, low back pain seems more appropriate, so I'll choose that. Immediately, I'm given a list of possible conditions that may cause back pain, as well as sorted by how likely they are. So Symcat generates this list by analyzing data from the CDC, which I'll tell you more about. But I could refine this list by entering in more information. So here, my symptoms have been going on for about a day. I'm a female adult. And as you can see, with each piece of information I provide, the probabilities and likely conditions update in real time. Just like with my doctor, I could say I've also been having other symptoms like fever. And now here I notice pyelonephritis, which is kind of scary sounding, comes to the top. So I can click on that for more information, as well as see what associated symptoms are. So I decide maybe I have side pain as well. And in that case, pyelonephritis is even more likely. But let's go back and say that I'm actually just having my low back pain. The next set of questions are my past medical history, or conditions that I've had in the past. So here we're going to say that I'm mostly healthy, but I have I've had diabetes. Again, Symcat analyzes CDC data to offer me tips about what I'm at risk for given my past history. So pyelonephritis comes up as something I should be concerned about or keep an eye on. Now, the next set of questions are intelligently generated based on the profile I've already entered. So these are red flag symptoms or questions that a doctor might ask me if I came in having back pain. In this case, I'm going to say I'm mostly well except for the back pain, or maybe I've been having some leg weakness. So I'll select that. I've been having the symptoms now, and in this case, Symcat recognizes this as a red flag symptom and suggests I seek emergency treatment. I could scroll down and hover over my options to see what they are, as well as what's appropriate and what I'm likely to pay for each of the options. So in this case, maybe I decide an emergency room is for me. So I can click on that and get a nearby list of emergency rooms, as well as turn-by-turn directions. I'm going to go back and say maybe I'm skeptical that the emergency room is right for me. So I'll click on the Speak to Provider option, select my health plan, and here they offer a nurse advice line I could call for additional help. If my health plan offers additional benefits, additional telemedicine, that would appear here as well. Let's go back and say that actually it's just been the back pain that I've been having. So I'm going to go back and say no leg weakness. In this case, I'm asked some additional questions. So Symcat, again, is calculating those questions that it should ask me. So these are the less severe questions. So they're asked later. But in this case, I'm going to say I'm not really having any of these either. So now, in this case, Symcat will calculate its suggestion. And in this case, there are no red flag symptoms. So it's going to say that I should seek a primary care help. So again, the options are listed below, and you'll notice that they're contextual based on the information I provided. So I'm offered some self-care instructions to treat at home. If I decide that I still want to see a doctor, I can go to an urgent care center and, just like before, map them out, similar to emergency rooms. But in this case, I am most interested in scheduling with a doctor for long-term follow-up. So I can do that, and I'll take you here. So Symcat remembers all that information that I provided, the symptoms and my demographics, and attempts to match me with providers that are most relevant to me given quality metrics. So here we're ranking facilities based on how they perform using Aligning Forces for Quality data, which is a Robert Wood Johnson Foundation initiative. I could click on any one of these to see where they are, as well as get a rich profile that includes information about the facility that they provide, hours of operation, languages spoken, and the quality metrics, which of course I can drill down into and see more about what might be relevant to me. So here's a metric on back pain. And just like before, I can map that facility, say I decide to go to Abington and get turn-by-turn directions there. So as you can see, the intention of Symcat is to, within 5 minutes, guide you from the symptoms you're having to the solutions, finding a quality provider or self-care. So now what I just showed you is the web app, but in fact, Symcat is designed to be convenient really wherever you are. So our mobile app allows you to access Symcat on the go, and our API makes it easy for third parties to drop it into their existing health portals. So now that I've showed you what Symcat is, allow me to summarize how we use data to help you learn what you may have and find the right provider. So first, with respect to learning what you may have, we analyze CDC data. So this is from their biosurveillance program, visit-level data with symptoms and diagnoses. We feed that granular data into our machine learning algorithm so that for any arbitrary set of symptoms and demographics, we could generate these lists for you with probabilities. We then match those concepts to the relevant articles in the National Library of Medicine's Medline Plus Health Encyclopedia. Then finding the right provider. So we use a number of directories. The first is the National Provider Index, which anyone who accepts Medicare and Medicaid payments must enroll into. And then Google Places allows us to find where they are, that is an address, and map them. But they would just be points on a map without the additional data provided by the Aligning Forces for Quality initiative, as well as Facebook, actually, perhaps an unlikely source, but they provide a means for the facilities to actually share their own information with potential consumers. So if there's a moral here, I think it would be that the data are out there, you just need to be a little crafty about stitching them all together, and that's what we're doing with Symcat. So thanks for your attention and allowing me the opportunity to share Symcat with you. Please stop by our exhibit later and say hi. Thanks.
Thank you, Craig.